Daphne Broadhurst. I'm a clinical nurse specialist with Infusion Excellence Consulting. In part 1 of this video series, you learned what the Surefuser is and some of the key things to keeping everything clean. You're almost ready to start your pump. In this video, you'll learn how to set up to start the pump. This video will provide general instructions. Make sure, though, that you follow the information that your healthcare provider gives you. In the first video, you learned to always work in a clean, quiet area. Scott has already cleaned the table. He's washed his hand. The Surefuser needs to be at room temperature when you use it. This will help it run at the right speed. Make sure you take the pump out of the fridge however long your healthcare provider told you to before it's time for your medicine. This will allow the balloon to soften and the fluid to come to room temperature. Never apply heat from any source to warm up the solution. Do not place it in the microwave, hot water, or sunlight. Heating the Surefuser may cause problems with the device and flow rate and might hurt you. So make sure it comes to room temperature. You need to get your supplies. It helps to keep things clean if you put your supplies in a clean plastic container. You'll need 2 flush or saline syringes. Use the number that your healthcare provider taught you to use. We're using 2 for this demonstration. You need alcohol swabs or the kind of disinfectant swab that you were given. You'll need a dressing, a small piece of tape. And if you're told to use gloves, then you'll need gloves. And then, of course, you need your Surefuser that you will have removed from the fridge earlier. You also need your instructions that you're going to follow. With your Surefuser, don't forget you always have to check a few things to make sure it's the right pump for you. Look at the label on the pump. You want to make sure that it's the right one for you. Is it your name? Is the medicine name right? Is the dose of medicine, such as 2 grams, right? Check the expiry date to make sure it's not passed. There's also an expiry date on the label on the pump, so read that expiry date as well. Now let's look more at this Surefuser. Is the fluid clear? Is there anything floating in it? Are there any leaks or damage to the balloon or tubing? Is there anything floating inside the medicine in the balloon? Is the clamp on the tubing closed? Are the caps in place on the top and bottom of the pump and the little blue cap at the top? Look at your flushes. Is there any damage or leaking? Are the caps in place? If the answer is no to any of these questions, you don't use that item. Get another one and check it. Every time before you use a Surefuser, what do you need to check to make sure it's okay to use? You have to make sure it's at room temperature. You're going to check to make sure that there are no leaks or damage to the pump, and make sure it's not past the expiry date. You've also checked that it's your name and the right medicine for you. You've just checked to make sure your Surefuser is okay to use. Now you need to make sure that your IV or PICC or sub-Q set is okay. First, look. Is the site red? Is your arm swollen? Is there any fluid under the bandage? Is the bandage loose or dirty? Now touch it and the vein where the IV is. Does it feel sore or warm to touch? If your bandage is sticking well, everything looks clean, and there's no discomfort, you're ready to start your medicine. If not, follow the instructions you were given if you have a problem, such as call your healthcare provider. Now you've checked that your IV looks good. You need to check that the IV is working well. You need to flush or rinse the IV or PICC. So the first thing you're going to do is, if your IV or PICC has a clamp on it, open the clamp. So here Scott has a clamp on his extension set, so he's going to open that. He's also going to check his PICC to open the clamp on his PICC. So he's going to press that to open it. Now take the flush syringe out of its wrapper. Now hold the flush with the tail end down. Do you see any air bubbles? If so, tap the flush against the table. And this sends any air bubbles to the top. Sometimes you have to flick the side of the flush if bubbles are sticking to it. Now you need to break the air lock that's in the flush. Loosen the cap. Just twist it counterclockwise one turn, but keep the cap on. Push your thumb gently on the tail end of the flush. This will push air up out of the syringe. You'll hear a click and see a bit of fluid coming out of the flush at the top. Once all the air bubbles are out of your flush, set the flush with the cap still on in your container. Before you flush now, you need to scrub the hub. Some patients have an extra cap on their IV to keep it clean. This colored cap on Scott's extension set is called a disinfectant cap. Not everybody uses this one, but Scott, I'm going to have you twist off the cap. Inside there is alcohol, so it will have scrubbed the hub of his cap. Let the disinfectant dry for 1 minute, or however long you were told by your healthcare provider. Now, if you had that disinfectant cap like Scott had, and it may be green, there are other colors as well, you can skip this next step that Scott's going to show to clean your IV or PICC. So if you don't have a disinfectant cap on it, you need to scrub the hub with a disinfectant wipe. Rip open the alcohol wipe wrapper across the top of the package. Pick up the alcohol wipe in your dominant hand. Hold your cap in the other hand. Now you're going to scrub that flat end of the cap of the hub for 15 to 30 seconds. Make sure you clean the tops and sides to remove any germs. You now have to wait for 15 seconds to let the alcohol dry and kill any germs, or however long your healthcare provider showed you. It may be an alcohol swab, but it could also be a different type of disinfectant, whatever type of wipe that you were told to use. This is now a key no-touch part. Make sure that nothing touches this clean cap. If it did, you'd have to get another wipe and clean it again. Now you need to flush your IV to make sure it's working okay, that it's not plugged with medicine or blood. Pick up your flush, hold the IV in your non-dominant hand. Unscrew the cap to take the cap off the flush. The open tip of your flush is now a no-touch part, as well as, of course, the clean hub of your catheter. Screw the flush onto the IV. Push the syringe in to the hub and twist the flush. Push on the tail end of the flush. Push, stop, or squirt, squirt, squirt. This helps to rinse the IV well. You should also be feeling how hard it is to flush. It shouldn't be hard, and making sure that there's no pain or leaking at your IV site. When the flush is empty, twist off the syringe and set the flush aside. You now know that your IV or PICC is working well and you're ready to start your medicine. Before you connect your Surefuser to your IV, let's review what you need to do every time to get ready to hook up your pump. First, check your Surefuser to make sure the label is right, that there's no leaking and the fluid is clear and the caps are in place. Then check your IV site to make sure the bandage is sticking well to your skin and that the skin is not red or tender and there's no leaking. Always work in a clean area and wash your hands. Before you use your IV, you need to check though that it's working well. So scrub the hub of your IV and then flush the IV to make sure it flushes easily. Now you know how to safely prepare to use your Surefuser. In the next video of this video series, you'll learn how to hook up, start, and then disconnect your Surefuser. I'd like to thank CardioMed for their educational grant to support the development of this video. Thank you.